Now to the COVID-19 situation and how it affects the schools. The World Health Organization has stressed the need for Africa to consider reopening schools, stating that the prolonged closure due to COVID-19 is causing more harm to children. WHO notes that the extended impact of schools closure has led to exploitation among children, with increased cases of childhood pregnancies and exposure to violence. On the other hand, the Ministry of Education says it is better to safeguard the lives of the children rather than rushing to reopen. Helen Aura has the details.
Since the outbreak of COVID-19 in the country, the education sector has been shut down literally in an effort to avert the spread of the virus. According to a survey by WHO, in 39 sub-Saharan African countries, only 6 countries have reopened schools. 14 countries have schools closed, while in 19 countries, schools are partially open. Among the sub-Saharan countries, at least 12 are planning on resuming in September. This distribution has led to children being exposed to increased cases of violence, poor nutrition, as some families are going by without a meal as a result of family breadwinners losing jobs, thus being unable to fend for their families. The mental development of children, the WHO says, is going to suffer.
Education is a pathway out of poverty towards prosperity and better health for the African continent and for the world. The decision to open schools or not amid the pandemic is a difficult one, but we must find the right balance to avoid trading one adversity for another. The longer that children are out of school, the greater the risk that they may not return to school.
According to Education CS George Magoha, Kenya will not make hasty decisions in reopening schools.
Every Kenyan child has a right to live. Yes. If we are to open schools before we are prepared, before the disease comes down and is controlled, a number of children are going to die. Whose children are these that you want to sacrifice?
According to a UNICEF survey, in Eastern and Southern Africa, violence rates among children have gone up within the COVID-19 pandemic, while nutrition rates have also decreased.
Keeping children away also further expose them to risks that are known, risk of being emotionally, physically, and even to a certain extent sexually abused.
UNICEF and WHO have issued out guidelines that will aid in the reopening of schools, such as physical distancing, cancellation of school events, providing hand-washing facilities, wearing of masks, discouraging unnecessary touching, and ensuring that sick students and teachers stay at home. The Ministry of Education has in the meantime urged tertiary learning institutions to ensure they are well prepared before reopening. Helen Aura, NTV.